some questions from ENT. So let's go to the questions. A 6-year-old previously healthy male is brought to your office for the right ear pain. His mother states that he has been pulling at his ear for the past 2 days and has a complaint of discomfort. So pulling ear, it means he has some otalgia or pain in the eye, in the ear. He states he felt warm but has not taken his temperature. His birth history is unremarkable and has no past medical history or no significant medical history. The vital signs are temperature is 38 degrees C, heart rate is 100, blood pressure is 100/60, respiratory rate is 18. A right otologic exam is seen in the figure number A. Of the following organism listed below, which is most likely responsible for the patient's conditions? So they are not asking about what type of disorders this patient is suffering from. We need to guess from the given history and from the examination of the tympanic membrane. So here given tympanic membrane. Normally what happens, normally the tympanic membrane is not bulge outside. The blood vessels is not remarkable or not visible prominently. And the tympanic membrane is color approximately whitish or grayish color. So here we can see that the tympanic membrane is reddish or pale. It's bulge outside toward the external auditory canal and the blood vessels are prominent. So it means that something in the middle ear pushing the tympanic membrane toward the external ear. So if you talk about a case of acute otitis media, so there are stages. Number first stage of acute otitis media is tubal occlusion. Number second stage is pre-suppurative. Number third is suppurative. Number four is the resolution. And number fifth, if it is not treated, then it goes for the complications. So what does mean tubal occlusion? Tubal occlusion is mean that infection from the nasopharynx by the eustachian tube go to the middle ear. There is the inner ear. There is the external ear. So if there is a disorder of the disease or infection of the nasopharynx, it causes inflammation of the eustachian tube. The eustachian tube lining becomes swollen, engorged, and causes the occlusion. This occlusion disturbs the transfer of ear balance between the middle ear and nasopharynx. So normally air start to trap and the pressure start to increase initially. So this is for the tubal occlusion. So the pressure start to increase initially. Then the air is absorbed by the mucosal lining of the middle ear. So the pressure start to decrease. The tympanic membrane normally lies tilted, start to retract inside. So with the time, the secretions start to accumulate into the middle ear, and these secretions, what they do, they start to accumulate, and again the pressure is now increasing. The pressure start to increase, the build up. So the pressure start to build up. Now tympanic membrane is not retracted. The tympanic membrane is pushed outside. It pushes outside, and now the tympanic membrane combines like this. Then we can see that the tympanic membrane is engorged, tympanic membrane is inflamed, and bulge outside, and the blood vessels are also prominent. So this is what a case of acute otitis media. Normally it goes different stages like tubal occlusion, pre-suppurative, suppurative pus formation into the middle ear. Then gradually it causes the perforation of the tympanic membrane, and the pus start to drain outside. Then the condition resolves. If it is not so, it leads to complications, intracranial complications. The infection start to necrotize or destroy the ossicular chain in the middle ear. Either it causes the progression of the disease toward the middle inner ear as well. So there are certain other complications, but our aim is not discussing the complications. So what they're asking which organism is the most likely responsible for this condition or acutitis media. So we have streptococcus infections, streptococcus pneumonia, followed by Haemophilus influenzae, followed by Moraxelia catarrhalis. So we cannot find streptococcus. Staph aureus is not a common cause. Pseudomonas aeruginosa mostly causes external otitis. Neisseria meningitidis is not a cause. Streptococcus eclectia is not, so Moraxelia catarrhalis is the answer. Let's go for the next question. A 28-year-old swimmer present to the outpatient clinic with ear pain, especially with the traction of the external ear. Otoscopic exam revealed an inflamed ear canal with cerumen present. A diagnosis of the otitis externa is made before topical antibiotic or prescribed. Which of the following must be occur? So it is a case of otitis externa. So why they said about the swimmer? Because it is also called as the swimmer's ear. Why it is called as the swimmer's ear? Because whenever the swimmer swim, it affects external ear or otitis externa because of the Pseudomonas aeruginosa. So it is common in swimming pool. So after swimming, patient feel like otalgia or pain. So it is the condition. Here we can see crusting mucus. So they are asking that for this patient who is suffering from otitis externa, what we need to do before prescribing antibiotics. We need to clear these pus or the debris from the ear. So for the debridement, we need a wire loop. With the help of wire loop, we start to remove the cerumen. So what happens if we remove the bacterial overload decreases, easy absorption of the drug, and what happened? Cleaning makes the ear or the external ear fast recovery. So culture of the any purulent discharge, yes, it is neat, but it's most commonly by Pseudomonas aeruginosa. So we no need to do this. If we think that we need to do to know the exact cause, then you should do. But before the culture results says you about the organism, you need to give high or broad spectrum antibiotics. So it is not need to do before giving antibiotics. Removal of cerumen, yes, this is true. Irrigation is not necessary because it's used for crusting. Analgesics, yes, we can give analgesics, but before that, we need to treat this condition by etiologic cause. So we will prefer the antibiotics, and also if the patient is pain, definitely we will give for analgesics as well. So let's go for the next question. A 68-year-old woman presents to the emergency department complaining of the ear pain and purulent discharge. On otologic examination, the tympanic membrane is found to be intact, with the external ear exam shown in this figure. There is a mild weakness of the ipsilateral face. Which of the following could predispose this patient to this condition? So it is again a case of otitis externa, but this time you can see that purulent discharge that form a crust, and the infection is not superficially, it also go deeper. That causes the weakness or damage of the nerve. Okay, so we can say that it is a condition where the bacteria is highly virulent. So number first, the bacterial virulence is high, and number second, the patient is immune compromised. So what other conditions? It may be diabetic mellitus. It may be HIV suffering infection. It may be corticosteroid intake, or it may be some other immune disorders that make the condition that makes the patient's condition more vulnerable and more susceptible for the infections. So we will go for the answers. Is it diabetic mellitus? Yes, diabetic mellitus is the cause. Hypertension is not. Hypercholesterolemia is not. Neurofibromatosis no. Infrequent swimming, yes, but it is not so severe, and there is no bone erosion, and there is no penetration of the organism, and that causes the weakness of the ipsilateral face. So the next question is: an 18-month-old child is brought in by her mother for the symptoms of irritability, poor oral intake. The mother does not report any ear tugging. On otologic examination, the tympanic membrane is noted to be bulging and hyperemic, and there is no reflex of light. Which of the following organism is the most likely cause of this patient's acute condition? The same question, but the theory or the question they change they modify the question, but examination again reveals that what the tympanic membrane is engorged, past tensa, past flaccida both, and the blood vessels are appearing here, and it is red in color. It means that there is a case of acute otitis media, and the cause of acute otitis media is Streptococcus pneumoniae, followed by Anopheles influenzae, followed by Moraxella catarrhalis. So why this is they said 18 months? So it is common in children because if you again go for the first question as we discussed there, that from the nasopharynx infection moved to the middle ear with the help of a tube, that is a Stitchen tube. So in children the anatomy of the tube is such like that the infection from the nasopharynx can easily go to the middle ear because the Stitchen tube it's short, the length is short and highly mucus producing, or the mucosa is thick, and it's more horizontally located, placed, so more horizontally short. So that's why the bacteria can easily go to the middle ear. So the organism here is again Streptococcus. So oh, they gave us Haemophilus as well. They gave us Streptococcus. They gave us Moraxella. So what should be the most common? The most common is Streptococcus pneumoniae. Next question is that at 12 month again the child with no significant past medical history is brought to your office by the mother for fever of 2 days. The mother states the child has a runny nose. Now they said that the patient has some rhinitis or nasopharyngeal infection or upper respiratory tract infection and cough period. And Hayes noticed the patient pulling the right ear over the past 2 weeks, 2 days. The mother also reports a temperature of 105, 102 Fahrenheit at home for the past 2 days, which has somewhat respond to acetaminophen. The patient has no known drug allergies and does not currently take any medication. The vital sign towards our temperature is 39, heart rate is 110, blood pressure is 100/60, respiratory rate is 20, and the saturation is okay. Physical examination is notable for an abnormal right tympanic membrane. Which of the following is the most appropriate treatment for this condition? So now I think you can easily guess what is this. Tympanic membrane, inflamed tympanic membrane, swollen tympanic membrane, and the blood vessels, they are again prominent. So it is the card feel appearance of the tympanic membrane. Seems like this card wheel. Okay, these are the blood vessels in ghost. So is again acute otitis media. And what should be the treatment for this? Normally it is spontaneous regression by formation of rupture of the tympanic membrane and a small. We can also make a small incision and drain the fluid or drain the pus from the uh, middle ear. But that is not necessary in acute cases. We give first for antibiotics. So what should be the antibiotic for such patient? That is high dose amoxicillin. So the answer of this question is amoxicillin. That is high dose amoxicillin. So these are the questions. Thank you very much.